morning. I'm Dr. Jesica Saepoff. You're listening to Dental MD, and I am a practicing dentist. I practice holistic, natural, biological, integrative, whatever word you want to put in front of that. I just say natural to keep it simple. And also because when people think about alternative medicine, the term that they use the most often is natural medicine. And so I think natural dentistry is a natural way to say that. So there are no natural or alternative dental schools anywhere. Everybody that is practicing in an alternative way or practicing according to the principles of natural medicine, as I say, we all have learned that on our own. We've all done special kinds of continuing education or learned it the hard way through our own medical journeys or the journeys of people close to us. And there actually is training for dentists who have already become dentists. There's no like dental school, but there's continuing education that is alternative, and there's a lot more of it that's mainstream. But there is continuing education, so that and including courses for beginners, fundamentals of having a biological practice, alternative practice, and there are more and more dentists that are seeking this out. But still, we are very few and far between. If you've ever tried to find a holistic or natural dentist, you know that sometimes you have to drive a long way, just like it used to be with grocery stores. Do you remember the days when if you wanted organic food, you had to drive to some other city that had a co-op or had a grocery store that had food you could eat? Well, now they're everywhere, especially if you live in sort of conscious areas that are conscious, have a conscious population regarding these particular issues, and have decided they want natural, organic, holistic services and food. And Western Washington is amazing. It's one of those areas. We have more practitioners here, more grocery stores per capita, more alternative training per capita here. We have Bastyr. We have all kinds of interesting ways to get more education right here in Western Washington. So the point of all of that is that sometimes dentistry has fallen a little bit behind in this, and in that physicians, MDs are having to, in their profession, they're having to deal with a lot of alternative practitioners that are medical, like osteopaths, chiropractors, and naturopaths, among others, Chinese medicine, all kinds of doctoral level doctors that are practicing alternative medical modalities. In dentistry, there are still very, very few of us. And there are more and more dentists that are not using mercury, for instance. That's kind of an obvious one. But you could go into a mercury-free practice and be kind of pressured into having fluoride treatments because they only know the mercury issue and they don't know the fluoride issue or all of the other issues, and there are many. So today's topic for today's show is the difficult choices that holistic patients have to make sometimes. Sometimes it's not difficult and they have very clear ideas of what they want and don't want. But, for people who are facing choices like a root canal versus losing the tooth, extracting the tooth, that is a very difficult choice. I think that's difficult for everybody except people who are absolutely sure that they want the root canal or absolutely sure that they would never get a root canal and just there's no choice for them. It is that tooth's coming out. So, but for the majority, these issues are very difficult to work through. It's, you're faced with this choice and you have to suddenly educate yourself about all of the future ramifications of the choice you're going to make for that tooth. And that choice may include things that have to be done to other teeth because as a result of that choice. So, yeah, it's difficult, and you need good counseling from professionals to get all of the advice that you need so that you can make up your own mind, because it's your body. Now, in most offices, including a lot of holistic offices, they will try to steer you toward the choice that they think is best for you. Now, I consider that to be a paternalistic management model, and I think it's on its way out, honestly. Thank goodness. But it's still the prevalent way that offices are managed and that patients are managed. Do you know that you're managed? Yes, they are managing you. So when you have these choices and you feel that where you are, you're trying to find advice and you are not sure whether the advice you're getting is self-serving for that practice or whether that advice is really like just the information that's pertinent and relevant for you, and that's what you're getting. This is where discernment and practice hopping really starts to happen. You have to get second opinions, more than one of them, third opinion, fourth opinion. And if you go to all offices that basically are run that same way, you're going to be steered toward choices, but it may be a different choice depending on what kind of office you're in. But if you would like to not be steered, then you have to find a practitioner that's no longer managing you as a patient in that way. And I know there are a number of dentists out there that really do operate their practice like it's your body, you get to choose, and are very clean and clear about that with you. Some offices will say that and then immediately begin directing you and steering you after convincing you that that's not what they're doing. Sometimes they call it educating you. But if you feel like you're being steered, well, you're being steered. You're being moved along in a thought process with their guidance toward a particular choice. Sometimes that choice is the choice that makes that office the most money. Sometimes it's the choice that that dentist thinks is the right choice for you. It may not be the thing that makes them the most money, but they still think that's the choice you should make. And so they steer you that way. Maybe it's the choice they would make if they were in your shoes. None of that is a relevant way to, in my opinion, all of that remains within a paternalistic mindset. So let's look at what some of these difficult choices are and what the information is. This show here that I'm doing is about helping you to ask better questions. You can ask questions that are about relevant issues for you. And a lot of times we don't even know what questions to ask because we don't have enough information to even form a question. And so I'm here to give you general information so that you can become naturally curious about the things that I'm saying and how they relate to your situation, and questions will arise in your mind that are relevant for you. And those are that's your direction. That's how you move in the direction of getting the information you need so that you can make a choice. And you'll know when you've made that choice. I mean, you'll feel clear about it. You will feel settled and confident and resolved in your decision. And that happens when questions aren't coming up in your mind anymore. So I'm here to give information to help you ask better questions to get the information that is needed for you so you can make choices for yourself. And this show has been on the air for about 6 years. You can go into the archives on KKNW, 1150 AM, and look up Dental MD radio show, and all the archives are there. There are lots of different topics, and you can listen to a show. They're also on SoundCloud, some of them. So listen to shows that are related to the topics that you are dealing with or have questions about for yourself or for your family. And and if you have questions and you want me particularly to help you with the issue or help you figure out, what you need to know so you can make your choice, you can come in for a new patient exam, a specific exam, which is where we just talk about a specific topic and don't do a comprehensive exam. And that's the specific exam is basically the second opinion exam. Somebody told you need this or that, or gave you information or got you concerned about something or offered to do something, and you're not sure if you want to go ahead with that. And so you would come to an office like mine out in Issaquah and have a second opinion appointment, which is what we call a specific exam. We would probably need to look at x-rays in order to give you information about your situation. And if you don't have x-rays, or the x-rays that you bring or have sent don't have all the information for me, then I might take an x-ray to help with the conversation so we have more information. And I will take a look, and we'll talk about what all of your options are and what the ramifications are for the future for each of those choices, because that's what you need to know. And then if it's something we do at our office that you select and you would like me to help you with that and do that treatment for you, we can do that. And if you don't and you want to go back to your dentist and say, I've decided I want to do this instead of that, then you can do that too. You are free to go wherever you need to go, wherever you want, to have the treatment done the way you want it done. And we are also happy to help in any way before, during, and after whatever it is you're having done. So if you do want to contact us and you want me to have a look at something, give us a call. The phone number is 425-427-8899. And you can also reach the front desk by email, which is a great way to ask your questions, and we will get back to you by email. And that is appointments@naturaldentist.com. All right, we're heading into a break. You're listening to Dental MD. I'm Dr. Jesica Saepoff. I'll be right back.
Good day, sunshine. Good day, sunshine. Good day, sunshine. I need to laugh, and when the sun is out.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Our military service members volunteer to protect us in the most dangerous places around the world. They step up. And when they are severely ill or injured, returning to their families is only the beginning of their long road home. Beyond all the hospitals and doctors and surgeries they need just to survive, they also deserve whatever they need to truly live. all the in-home care and day-to-day help they need to live independently on their own terms. Wounded Warrior Project long-term support programs were established to provide these brave men and women whatever they need to continue their fight for independence at no cost for life. So many of them need us, and it's time for a grateful nation to step up. Find out how you can do your part at findwwp.org.
Multicultural, multidimensional even. Alternative Talk 1150.
I got something I can laugh about. I feel good in a special way. I'm in love and it's a sunny day. Good day, sunshine. Good day, sunshine. Good day, sunshine. We take a walk. The sun is shining.
Welcome back. You're listening to Dental MD. I'm Dr. Jesica Saepoff. Today I'm talking about difficult choices that you as a patient have to make sometimes, and how to go about getting the information that you need. Because a lot of times when you're sitting in the dental chair, what you're being told is what that practice wants you to hear so that you make a particular choice, which is something that they like doing at that office or make lots of money doing. And I hate to say that way. I mean, all offices are not that way, but frequently that is how people feel when they're sitting in the chair. Especially, they may not feel that way actually while they're in the chair, but when they find out later that there were other choices that they could have made and they weren't given those choices, like let's just take, for instance, orthodontics. You go and you're there with your child and the orthodontist says, well, we're going to have to, do this and this, and then eventually the jaw is going to have to get broken in order and surgically broken and put in a different place to really correct this properly. And before we do that, we're going to take out some teeth and get braces on, and then when they're this age, that we'll do that surgery. And it's absolutely necessary. There's no other way to fix this correctly. So when you hear that, and you go through all of that in your family, which is a really major deal. This is, surgery on somebody's face, their head. And it's quite a significant surgery. If anyone listening has ever been through orthodontic surgery, upper and lower jaw being cut and moved and bolted back into place, it is a big deal. It's really a big deal. The results, the facial profile and all of those things, very dramatic, sometimes very significant aesthetically, especially if somebody has a deformation or is disfigured for one reason or another, or post-accident, that kind of thing. But let's say you are told all of this and you do the initial ortho, and then when the child is 17 or 18, they undergo this surgery. And then a few years later, you find out that maybe, you don't necessarily believe this could have been done in your child's case, of course, but maybe there was a way to correct some of that non-surgically. Maybe they didn't have to lose those teeth. Maybe the ortho could have been done with a good result, not an excellent or textbook result, but a good result without doing that surgery. But you were only given the textbook results path. So it's tough. It's very tough, and you're there and you want to do the best thing for your child or for yourself, and you're told, here is the only right way to do this, the only good way to do it, the only way you'll get the best result. And you're not given other options. You're not given the option of, well, we could do it this other way. It'll look nice, but it won't be perfect and it won't be textbook. Is that okay with you? Would you rather do it this way and not have the surgery? Not everybody's given that option. And when you find after the surgery, you find out later that other people got a different option. That's kind of upsetting. So at the time that you're making the choice to go along with whatever the dentist is telling you must be done, you feel like you're making the only choice you can. But, this show, like I said in the first segment, I'm here to offer information that helps you ask better questions, different questions, questions that will lead you to information where you are making a more informed choice. Informed choice is a legal term, and it doesn't just mean that you have all the information about that particular option. It means you've been given information about all of your options, including what happens if you do nothing. That is informed choice, when you know all of your options, not just everything there is to know about the option that is being offered. That's not informed choice. An informed choice is not your signature on a treatment plan that only has the option on it that office gave you. So I am adamant that you, before making a decision that's going to have future ramifications, that you be given all of your options, including what will happen if you don't do anything. And frequently, that particular option, what happens if you don't do anything, that is where most offices, many offices, some offices, will give you the big scare. If you don't get that implant, your bone's going to disappear in that area. It's going to resorb. You won't have any bone left there. You got to get that implant done. You got to do it soon. Okay, so that is, what would happen if you didn't do anything, right? But still, that option is being presented to you in a way to deliberately steer you into not only the choice of having an implant, but having it done right away. Don't delay. Terrible things will happen if you take your time. But you need to stop and find out what else is available and what the other opinions are about what will happen if you don't do it. I mean, what did people do for, hundreds and thousands of years? We'll say hundreds. Before there were implants, they didn't die just because a tooth came out. So, it's not dire. And also, if you do have some resorption, which can happen and usually does happen, but not like quick or urgent, you're not going to lose your whole jawbone. And even if you do have some resorption, there are procedures if you decide later that you do want an implant and you've had some resorption, or you had a tooth extracted 10 years ago and nobody gave you the implant option, and now somebody's saying, well, in order to do an implant there, if you're deciding you want an implant after all, that they can do ridge augmentation and rebuild that bone, rebuild the shape of the bone where that implant is going to be placed. That's common these days because a lot of people had extractions years ago, had some resorption, and now they do ridge augmentation. So anytime somebody is trying to get you to do something soon, you better hurry up and come in and get that done, whatever it is. Just sit back, relax, try not to feel rushed or, frightened into a choice that may not be the choice that you would make if you had taken your time. There's really something to be said for sleeping on it. Just, go home, relax, start searching on the internet, start asking questions, find dentists that do things in alternative ways and see what they have to say. Now, dentists that do things in alternative ways are not necessarily doing things substandard, because alternatives in the mainstream, if you're doing it alternative, then it's not the standard of care. But that's not really true, because there are many options, many ways to do anything you name in dentistry. And if you go to a dentist that's been well trained by recognized experts in alternative methods, and they have a good record, and they're not, they haven't been brought up with charges by DQAC multiple times or anything like that. And you can check out people, you're going to find mainstream dentists and holistic dentists that have had complaints made about them to the dental board. And that's something you may want to check, especially if you feel unsure about something. But, that going out and getting alternative opinions by dentists that do things differently, not just another mainstream office with the same basic training and points of view. Break out of that paradigm and get some really alternative opinions. And at my office, I do give second opinions very frequently. And there are a couple of procedures that I don't do in my office right now. We may be having a dentist that comes in and does some of those things in the future, but right now we do no root canals and no surgeries. So if you come in and you're choosing between a root canal and an extraction for a tooth because somebody told you that tooth has got to go or it has to have a root canal, come for a second opinion, or go to an office that is alternative for a second opinion on that, because in some cases I have actually found that the tooth didn't need either, that the dentist thought it was going to need those things, and so you should go ahead and choose and get one of those done. But I've tested teeth and done very gentle and careful, pulp healing procedures, and I've had teeth stay alive, and we wait and then we restore it, and some of these teeth go on for 5 and 10 years without any problems. So when you're being given a choice, those two choices may not be your only two choices. Waiting and doing something gentle and restorative to that tooth might actually be another choice. But you have to go to offices where they think in an alternative manner in order to get other ideas and form other questions in your mind. And so if somebody comes to me with that choice, and I do think they need to make that choice, either get a root canal or get an extraction, and I'll give everybody information about the ramifications of both of those choices, because they both have ramifications for your future and for some of your other teeth, I will refer. I don't do either of those procedures, but I'll give advice and information, and then I'll give referrals to people who do those procedures for the patient. So we are coming up on a break. You're listening to Dental MD. I'm Dr. Jesica Saepoff, and I'll be right back.
Try to see it my way. Do I have to keep on talking till I can go on? While you see it your way, run the risk of knowing that our love may soon be gone. We can work it out.
I'm Dr. Anthony Lazowitz, and this is Climate Connections. Each spring, blue blossoms blanket Texas fields. Some people drive hundreds of miles to see the state flower, the Texas bluebonnet, in bloom.
They're one of the wildflowers that just really can take over acres and acres, and it's hard not to be enchanted by that.
That's Andrea DeLong Amaya, Director of Horticulture at the Lady Bird Johnson Wildflower Center in Austin. She says last year, Texas bluebonnets bloomed early, after an unusually warm February.
I remember it was around spring break, which was mid-March. They were in full bloom at that point, which is not common.
She says bluebonnets are sensitive to rain and rising temperatures. So as the climate warms, Texans may see early blooms more often. The burst of color is exciting after a drab winter, but gardeners are wary of early springs.
We get a little nervous because if we start to have a span of warm weather and the bluebonnets start to bolt, to elongate before they start to bloom, they're really susceptible to a hard freeze then.
It's not just a concern for bluebonnets. Gardeners across the country have noticed many species flowering sooner than usual as the climate warms. Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150 is like no other radio station. Here we provide a platform for the exchange of great ideas and positive energy. Our radio shows vary greatly, but do share a common goal of bettering listeners' lives. Perhaps you're ready to join our family of radio show hosts. Learn how affordable and rewarding it can be to host your own radio show. Call me, Eric Cream, at 425-653-1150. That's 425-653-1150, and let's discuss your radio dream.
Need help getting started with self-help? You came to the right place. Alternative Talk 1150.
Get out, think of what you're saying. You can get it wrong and still you think that it's all right.
Welcome back. You're listening to Dental MD. I'm Dr. Jesica Saepoff. Today, I am talking about difficult choices that patients have to make sometimes. And, you know, one of the big ones is, should I get a root canal or should I have the tooth extracted? Now, in mainstream thinking, there is no choice. Of course you get the root canal. Why would you take out a tooth when you could get a root canal? But we are talking about alternative medicine, natural medicine principles. And there is a reason why you might consider not having a root canal. And it depends on the situation. It depends on the tooth. Depends on whether it's dying from infection or if it's dying from trauma. If that tooth has a vertical fracture, that's not an infection. That is a form of trauma to the nerve. So, you know, getting a root canal on a tooth that is already infected, that is never going to be a sterile tooth. That is always going to have bacteria living in it. And in the mainstream way of thinking, bacteria living in the tooth is not a big deal. They don't hurt. It doesn't hurt. A few might escape from the tooth, and then if you're healthy, your bloodstream just comes and white cells take care of those few wayward bacteria. But for the most part, they stay inside the tooth and so aren't a problem. And that is the mainstream view. As long as it looks okay on the x-ray and it doesn't hurt, your root canal is fine. But it so happens that 100% of root canal treated teeth have bacteria living in the tooth structure just all the time. And that's, you know, is that a problem? The question isn't whether there are bacteria in it. Now, if a tooth dies from trauma and doesn't have an infection at the time that the root canal is done, what we think happens is that tooth does become colonized. You have a lot of bacteria in your mouth, the bacteria find their way in, and that tooth eventually is colonized. Some dentists have tried doing ozone treatments before, during, and after the root canal treatment to, you know, kill bacteria in there. And that's actually good. It gets all the way throughout the tooth structure and kills microbes that are living in the tiniest of the little tubules, and that's good. But how long does it stay that way? We have no research showing, you know, how often to do ozone treatments to make these things remain, you know, not colonized. And in between, while the bacteria are building up, you know, the real controversy is not whether there are bacteria. The controversy is, are the bacteria causing you any problems? In natural medicine principles, it's generally frowned upon to harbor a chronic infection. And the bacteria that are in these teeth that are dead and have had root canal treatment, they are alive and they're living off of diffused nutrients that just, you know, flow right in through the tooth structure, and they give off waste just like everybody, right? Now, how toxic is that waste? This is where the controversy is. How toxic is that waste? And some say not so much. Look at all the people walking around with root canal treated teeth. They're not dropping dead. They're not falling over. They don't seem to be sick. okay, must be all right. But we also have a lot of chronic diseases in our society that we don't know the causes of. So, nobody's going back and, well, people have studied this. Weston A. Price, for instance, did quite a bit of research on root canals and whether these colonized teeth can cause any health problems. You might want to look at that research. I think that, anyway. So whether or not the waste chemicals that are coming off of these bacteria is harmful to your overall health, that's the question. And that is, for a lot of people in the alternative medicine and dentistry, we are not questioning that anymore. We feel that level of toxicity justifies for a lot of people not keeping a root canal treated tooth or not having a root canal. But it's a very personal choice. If the tooth looks okay on the x-ray and it doesn't hurt and you're well, and that tooth is your front tooth, or it's a tooth holding up a bridge, or, if you lose that tooth, you're going to lose, something else like jaw stability or, whatever. You may choose in that moment of choice to go ahead with a root canal. And in my practice, the way I practice, it is your choice. It is absolutely your choice. It's also my responsibility to make sure you know that there are questions about it and that there's controversy in the dental field between professionals regarding the issues around root canals and their potential toxicity, we'll say. But what happens if you don't get that root canal? You basically, you don't want to lose a tooth. If you leave it there and it's dead, in dentistry we don't use the word gangrene very often, but that's what it is. You're walking around with a gangrenous tooth, and because you've got necrotic soft tissue inside the tooth, and if you have an abscess, you've got necrotic tissue in the bone as well. Well, that's not a very good, and it's colonized. I mean, the whole thing is infected, whether you get the root canal treatment or not. If your tooth is dead, it's infected, and you might as well get the root canal if you're going to keep that tooth sitting there dead, because at least then it's disinfected and cleaned up and more stable. So if you don't want to do the root canal, and you should not leave a tooth dead, just sitting there, festering, gangrenous, your only other option is extracting it. And that is a very difficult choice. It's an amputation. You're losing a body part. It's a big deal. You have to grieve. You have to think it through. You have to be, ready and get that done with resolve, because you don't want to have any regrets. You don't want to remove a tooth and then think later, maybe I should have had that root canal. I'd still have my tooth then. I don't want anybody to have regrets. I want you to have all of the information, and I want you to really be clear about what your choices are when you make that choice. I don't want anybody to look back years later and say, gosh, I wish I hadn't had that tooth out, or, gee, maybe I should have just had that tooth removed because I've had this toxic thing in there all these years. If you are going to agree and believe the research that shows that teeth that are dead and or have had root canals have a certain level of toxicity from emanating from the bacteria that live in the tooth. So these are very difficult choices, and I am, as I stated before, I am not going to try to steer you one way or the other. I don't do either of those procedures in my office. I'll refer you for consultations with both kinds of professionals that do root canals and that do extractions, and I will help you to get all the information you need so that you can make a choice, the choice that's right for you, that you can live with, that you will not regret. And the only way to ensure that is to make sure you have all the information you need to make a choice that you're comfortable with. And that is true informed choice. That really is what informed consent means. All right. We're going to be heading into a break here in just a couple of minutes. I want to give you some information about how you can reach us. If you want a second opinion from me or you want to come in and have a complete new patient exam, give us a call, 425-427-8899. The office is in Issaquah on Gilman Boulevard. And you can reach us by email, appointments@naturaldentist.com, and we will read your questions. And if it's something beyond what the front desk staff can answer for you, like questions about insurance or, whether we have openings in the next week or the next day or the next month or whatever, if you've got clinical questions, then they will come to me with the questions. I will jot down some answers, and you can get a few, brief answers by email on some things. But if you really want definitive exam and diagnosis and choices, then you have to come in and have what we call a specific exam or a complete exam. And then I can look at everything and give you all the information that I can give you. We have nice long appointments so that we, especially for new patients coming in, we have a nice long generous appointment so that we have plenty of time to go over all of your questions, all of your existing health issues, and tailor your treatment to your concerns, your beliefs and opinions, and your current health status. And you're gonna know you're gonna know a lot about your teeth, your mouth, your gums. We cover everything in that new patient exam. I look at, everything that's been done and everything that can be done, and we just talk about all your options. And then, if it is really complex and you're really looking at having a lot of different things done, we'll have a follow-up appointment, and we'll just sit down, you and I, and go over the treatment plan and prioritize things and kind of just tailor it to you and what your needs are and what your preferences are. All right, we're going to go into a break. You're listening to Dental MD. I'm Dr. Jesica Saepoff. I'll be right back.
You say you want a revolution. Well, we all want to change the world.
It took me a long time to be able to say Chandler has cancer, because that is such a scary word. St. Jude takes care of absolutely everything. And knowing that we don't have to pay for all of the medical expenses, that's huge.
St. Jude allowed me to focus on being a mom to Bryce. And sometimes I'm just in awe of the impact St. Jude has, not only on this community, but the world.
St. Jude is uniquely positioned to advance the cures of pediatric cancer, I think better than any other institution in the world. The contributions make a big difference.
Donors are important to us because you get the feeling that you have a team behind you. We have the resources and we have the focus. And so if St. Jude doesn't do it, who will?
St. Jude Children's Research Hospital. Finding cures. Saving children. Learn more at stjude.org.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Exploring new territory every day. This is Alternative Talk 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jesica Saepoff. And today I'm talking about the difficult choices that patients sometimes have to make. And that includes root canals versus extractions. And it includes whether to have bicuspids extracted in order to have orthodontic treatment done. And it also includes, in this last segment, I'm going to talk about wisdom teeth. So, should wisdom teeth be extracted? This is a difficult question for a lot of patients. They definitely prefer if they don't have to undergo surgery. I mean, obviously, you prefer not to have surgery. Now, when it comes to wisdom teeth, there is a point after which the surgery becomes more complicated, more difficult, more chance of, problems after the surgery, like permanently numb lips and tongues and things like that. So this is one of the reasons why wisdom teeth are extracted at such a young age, because you kind of want to catch that at the right time. And a lot of times wisdom teeth will be extracted and the individual is still growing, and later as an adult you look at a panoramic x-ray and you look clinically and it really looks like there was room back there for one more tooth. And that's a shame. It's a shame when that happens, because you might think it's no big deal and it's just, easier to keep everything clean when you don't have that tooth all the way back there that's tough to clean. But, there are plenty of people walking around with all their teeth, including their wisdom teeth, had room for them. They came in, they keep them clean, and everything is fine. Now, I can understand if a wisdom tooth has a problem, it's erupted in and it has a problem, like it needs a root canal, or, it's dying and somebody wants to do a root canal, or looks at that tooth and says, no way am I doing a root canal procedure on a wisdom tooth. They're too far back. You have to, the mouth has to be open so wide to get the instruments in at the right angle to do the root canal treatment properly. It's just logistically difficult. It's physically difficult to do it. It's hard on the patient. It's hard for the practitioner. They may not turn out well, and the root canal treatment itself could fail if it isn't done right. So a lot of times people who have all their wisdom teeth, later in life, a tooth will have a problem and they will end up having it extracted because a procedure simply can't be done well on a tooth that's that far back. And so then you end up losing one or more. And the other thing that can happen is you could get decay in the wisdom tooth. Now, when I see wisdom teeth and they have decay, I will look to see whether it's an area that's reachable. Sometimes it's not. I mean, you just cannot get a dental drill angled up there correctly to fix a cavity. That's just a fact sometimes. Or the patient in your chair has TMJ problems and really just can't open very wide, for doing a procedure well way back there. And in those cases, it's time. You just have the tooth removed. But, I'm willing to do a difficult restoration if my patient is willing to, put up with having that filling done back there. If they can tolerate me doing a filling and I feel I can do a filling adequately, properly, in a way that will last, like a normal filling, then I'm willing to do it. It may not be easy, but I'm willing to do it. And, sometimes even if just buying that tooth 5 more years or 10 more years, sometimes people would rather do that than have the extraction. And that's fine. I'm willing to do a tough, difficult restoration if necessary. But, a lot of dentists will say, well, you've got your wisdom teeth in, but this one has decay, have it extracted. And they're not even willing to do a filling or try to do a filling on that. oh, okay, that's their choice. But just so that you know, there are some dentists like me out there willing to do kind of more challenging, difficult restorations. So, wisdom teeth. When the kids are 15, 16, 17, you do need to get that panoramic x-ray done so that you can see, and maybe even a 3D, so you can see where the tooth is, how it's angled, and if that tooth is already impacted against the next tooth so that it's not even aligned in a way that it could come in at the right angle, then you know there just isn't enough room back there. But sometimes it's hard to tell and the child is not done growing, but some dentists are very quick to say, just get those wisdom teeth out of there. Here's a referral. Go get your wisdom teeth removed. But I say not so fast. For some kids that are still growing and it's not an obvious impact with the next tooth yet, I say wait, So that means a year from now we take another x-ray. Yes, because we need to look and see whether that tooth is still lined up in a way that it could come in. If it's, a year later and we take an x-ray and they're not aligned well, they're impacted, they've stopped progressing, you want to get those wisdom teeth removed before the roots fully form if you can. When those roots finish forming, that means they're closer to the inferior alveolar nerve. That's the nerve that runs along the jaw and innervates all the teeth and the lip. That's where you end up with paresthesia, which means the numbness persists. Or you have prickly, tingly feelings in that lip forever. You don't want to risk nerve injury. You want to do these extractions before they become riskier procedures. Also, just as a side note, after age 35, it is said in the textbooks, after age 35, if you have your wisdom teeth out or anything, the bone does not fill in as well. It may not fill in completely. It may not fill in as densely. For whatever reason, call it aging, call it just mature body tissues, whatever it is. So prior to age 35, the extraction healing is easier, better, more bone fill, all of that. Now, if you wait and you take out a tooth that's impacted, you can end up with a defect on the back of what is now your last molar in that row. You can end up with a very deep gum pocket because if the wisdom tooth was angled horizontally so that the crown of the tooth was flat against the root of your second molar, you can end up with damage to the second molar, and you can end up losing the second molar too. They may have to take out two teeth, the wisdom tooth and the one that it damaged right next to it. That's not a very good thing either. That's what can happen if you wait. So there are good reasons to get it done early, and in some cases, it makes sense to wait, take another x-ray, see the progress. When progress stalls and that the teeth cannot come all the way in, then it is time to not delay, go have the wisdom teeth taken out. And, there are a lot of dentists that just send everybody to have their wisdom teeth out pretty much. But if you are a parent that wants to really see whether your child has room for their wisdom teeth, then you have to go through this sort of waiting and watching thing. And then, when the decision is made to let the teeth come the rest of the way in or have it extracted, then you have to make choices at that time. Well, we are coming up on the end of the hour here in the next couple of minutes, so I just want to review for you how you can get in touch with us. The office, I'm still full-time in Issaquah. I do have a second office on Mercer Island, but I am just still focused on being full-time in Issaquah at this time. So come to Issaquah. It's just a little further drive unless you already live out there. And The phone number there, if you want to make an appointment for either a complete exam or a specific exam to have a second opinion about something that you have questions about, give us a call, 425-427-8899, and you can reach us by email, appointments@naturaldentist.com, and you can visit the website, naturaldentist.com, to see what else you may be able to read there about, services we provide, etc., and where we're located. All right. Well, thank you very much for listening. You've been listening to Dental MD. I'm Dr. Jesica Saepoff, and I'll be back next week.
The views expressed on this program are those of the host, guests, and callers, and not necessarily those of KKNW, its management, or other advertisers. Contests are the responsibility of the host of this program and not KKNW. This is Alternative Talk 1158.